Good morning. Good morning. You're welcome to our today's lecture. Today we'll take a look at what? What do you have now? AM, right? Good. AM 221. Actions and uses of medicines 1. Are we through with the routes of drug administration? Are we? So we'll continue from where we stopped in the routes of drug administration. So where did we stop in our last lecture? Huh? Where? Topical, right? Okay. We are still discussing the local routes of drug administration. So specifically we stopped at topical. We stopped at what? Topical. So let's look at, let's now go down deep into other local ones. Let's look at ocular. Ocular means what? Ocular means what? When you hear ocular, what comes to your mind? The eye, right? Good. So here, this route is for drugs used for treatment of eye disorders, eye issues, such as glaucoma, conjunctivitis, and the other injuries. Are we together? Glaucoma, conjunctivitis, injuries. Of course, you don't need to be told again at this level that the active ingredient is mixed with what? Excipient, right? Excipient, right? To produce different what? Ophthalmic dosage forms of different consistencies, depending. That's why you have the one that are in what? Solution form. Two of us. We have the one that is in ointment form, eye ointment, right? Yes, we have eye ointment, we have eye drops. So, is the nature of the vehicle another physical vehicle that will determine the consistency of the eye preparation produced? We discussed this in your dispensing. So, and also each of them, they are used for different purposes and at different times. Something like sometimes you want to maintain, you want the drug to have a maintained contact with the eye. Three of us. Now, in such case, you start applying things like gel or ointment. But what if in the process of maintaining the contact between the eye and the drug, and because of the nature of the consistency, gel and ointment, the patient may not see clearly. So what do you now do? And also you can say, okay, you apply eye drop, but there are some situations you need, maybe that thing is serious, you need steady contact. What are you going to do? If you put eye drops more little over a short period of time, it will clear. What do you now do? So this is area now you now look at how to, you can even combine the two of them. Yes, The physician may combine the two of them, the ointment or gel and the eye drop, the one in solution form. And how is that possible? So I don't know, with time now you start seeing prescription where you see eye ointment, eye drop of the same drug. How? How do you now advise the patient to make you to apply this what? This preparation? It's simple. You know that in the patient need to do what? See clearly, right? To be able to go from one place to the other. The patient may use the eye drop, the one is in solution form, during the day. During the what? During the day. Maybe 2 times a day or something, but during the day. But the eye ointment, maybe morning and afternoon, the drop. The eye ointment or gel, in the night, when the person want to sleep, he can apply the what? The ointment and sleep. So that as the person is sleeping, the person with the eye is closed, there are more contact with the eyes when the patient is sleeping. During the day again, it would have cleared during the day. In the morning, by the morning, the patient can now apply the normal eye drop before going out or in the afternoon. So with that, you'll be able to do or take care of what and the situation. So the liquid eye drops are relatively easy to use. Yes, wonderful. But they run off what? The eye too quickly to be absorbed well. So, but gel formulation and ointment, they keep the drug in contact with the eye eye surface over a long period of what time, but they can cause what blur. I'm not just explaining what you have read in this and that. I'm just explaining it so you understand it. So, blur vision. Sometimes you can have solid insert too. That release the drug what continuously and what slowly. That one is also what available, even though it is hard to keep. So in such case, do you think you can use such during the day? You can just manage to put it in eye, even though some patients open their eye while sleeping. Are you aware? Yes. Some people open their eyes while sleeping. I've seen a couple of them. I'll just come and do it. There is the eye will just close. After like 1 hour, it's open again. I'll go back here and do what? The eye will close. Research it and tell us next class. Please remind us, please. Remind me, please. Divine will research on why some people open their eyes while sleeping. She will talk to us in our next class. You heard me right? Research on that. You talk to us about that in our next class. It's time to learn from you. I want to learn from you too. Okay? Yes, sir. So let's continue. So of course, I have made it clear to you that ocular drops are mainly used for their what? Local what? Effect. There are many there are many ocular preparation, ophthalmic preparation. There are many of them. Of course, you should know that such preparation should be what? Sterile. Hope you know. You are aware, right? Yes, sir. Good. By the time we do isotonic solution, you understand better. Isotonic solution, you understand better. So there are many of them. We have artificial tears for those that have eyes. We have artificial tears. It's in the market. Artificial what? Tears. So there are some drugs used for treatment of what? Glaucoma. Drugs used for treatment of what? Glaucoma. You see something like acetazolamide. See something like betazolol. Well, I don't know if we do eye preparations in AM. Okay. When you no, I don't think so. Okay, there are many of them. We have tropicamide. We have phenylephrine. Those used to dilate the pupils. Now you know where conjunctiva is located, cornea and conjunctiva. Where is it located in your eyes? At least you okay, you see, okay, is anatomy you do diagram of the eye. Is it in anatomy? I think so, yes. From your knowledge of biology and the facie and this. So tell me, where is your cornea located? Where is your conjunctiva located? What is conjunctiva? Okay, your cornea is inside your eye. Inside your eye, your cornea. Wow. Don't worry, your conjunctiva will soon be here. So where is your conjunctiva? Okay, inside the eyes too. Wow. What is conjunctivitis? Okay, go ahead, show me. Okay, here. Here is your conjunctiva. Wow. Conjunctival sac, right? Where is sac? Sac is here. Here, and what is here? This place here. This place is what? I asked a question. No. These things are what you can just open your Google and see. See the diagram now. See how it is, and it's not a question that only I'm talking about. It's what you can. It's clearly is there, scattered all over the net. So I'm only pushing you to know how to use your phone well. Very important. Sometimes you just open your phone, so far because you are in health, you can just open any part of the body. Try to study. Nobody asks to study. You just open it on your own. Look at these things on your own. When you're not doing anything, you're not reading. Maybe you are saturated. You can just search anything. Just be going through it. You can be any drug. Just open it. Just be looking at it. Something is entering. Something is what? Entering. So try to divide your time for social media into two. I didn't say you should not go to social media because I go to social media too. But divide it just if you can divide it into two and use half of them. And now do all those things. It will help you to grow. Apart from it will help you in certain things you are doing in the class. Now that we are discussing routes of God, so you can on your own just search for route of God. You're not trying to read to come here to. When I just search it, try to make it real. Just look at it. Try to see one or two things. Something is entering without your knowing. So if you come to class like this, if I throw some questions, you can contribute. You can hold a conversation with me. Some of you now cannot hold a conversation with me for like 30 minutes because you don't know what to say. How, if you are loaded, you can hold any type of what? Conversation. But it's unfortunate. But I don't know why it's like that. Bring up a topic now. Some people cannot will not even know what to say. They are good that you start talking about. Let's move from medicals now. Let's go to what? Politics. What's happening in Nigeria? Who is the Senate president? They don't know what to say. They don't even know the name of their Senate president. They are not loaded. Two of us, even in the entertainment one, they think that they go to social media. Bring up now the latest release, the artists they don't know their names. Two of us, it's true. Which record label are they signed to? They don't even know. But they waste their time on what? Yeah. So the point I'm making is that you should what? Try to use your time well. That's the point I'm making. Read, study. It can be anything worth knowing. Study it. Today may be health. Tomorrow may be politics. Next tomorrow may be science and technology in the other may be entertainment. Try to diversify. You see that anywhere you see yourself, you can. Okay, let me not go too far. So now the point I'm making is that this drug, of course, conjunctivitis is what? Inflammation of the what? Conjunctiva. Okay. Conjunctivitis can be bacterial. It can be caused by what? Bacteria. Yes. It can be caused, we have bacterial conjunctivitis. In that case, now if you are applying antibacterial eye drops, it will work. Am I communicating? Then we also have conjunctivitis that is caused by allergy. Allergic what? Conjunctivitis. If you die in that case, you start using eye drop that takes care of what? Allergy, allergy. Maybe some of them betamethasone eye drop. We have, although we can have some of them combined with neomycin. Neomycin is antibiotic. Am I communicating? That can help to do or take care of the what? In case it has been infected without your what? Knowing. But basically, then we also have the popular brand we call Spasalage, Antalage, that contains antazoline and one other component. And I don't want to confuse you more, but it's better. It's good you know these things because I don't know when you do it again. So I'm trying to point out that there are also eye drops that are used for what? Viral. Yeah, we have viral conjunctivitis. This will be a normal one you call what? Apollo, where your eyes will be itching red and they transfer from one person what to another. Is viral what? Conjunctivitis. You call it what? Apollo, right? The viral conjunctivitis. If you like, use the whole antibiotic. It must run its at least 7 days course before it will do what? Clear. But you can believe that you can be using drug that will help to relieve pain and inflammation, but not that you are treating that viral infection. Am I communicating? What's that? Ask. What? What's the content? What's the active ingredients? Names, you must not know all the brand names. Am I communicating? Unless that brand is popular. Am I communicating? People can formulate a product today, and give it a name. And if you call it, people may not know the name. True of us. But if you can tell me the brand, the generic name of the can you search them? Do it now. Search what they contain, the active ingredients. From there we can. Okay. What causes the viral? Find out. Browse it. Find out. Viral is from where? Find out more and tell us in our next class. Sodium what? Okay. So what's your question now? What is used for? Is it used? Check it. Is it used? Is it used? If it's used, let us know. God bless you. Allergic. That's the main thing I want to hear from you. Allergic. It's not virus. It's not what? Bacteria. Continue. Sorry, continue.
It's well for allergic conjunctivitis and then eye allergies, ensuring sweet comfort and reduce symptoms.
Good. Sit down. Allergic. Anyone you're going to use for, if truly you are treating bacteria at the conjunctivitis, must be an antibiotic. Am I communicating? Good. If you say conjunctivitis general, it's a general term. Which conjunctivitis are you talking about? Severe allergy. I don't understand what it means.
Someone that has an eye allergy.
No, continue. You are repeating what we're discussing now. So that's why I want to know if there's any new thing you want to say. But you said we're talking about allergic conjunctivitis is where?
Someone that has eye allergy, because you use this one, right?
Yes. You can use it. You can use it. You want to recommend it for somebody? Okay. Glaucoma. No, there are fluids in such eye, right? We have viscous fluid and aqueous fluid, right? And the pressure, what if the just like what the pressure, the blood pressure does, high blood pressure does in the body. When a pressure is increased inside, call it a vessel or whatever, or inside a closure, you know what it means now. So when that pressure inside when the pressure in the fluid is much, it can cause what? Glaucoma. That's what intraocular, inside the eye pressure. The pressure in the fluid, the pressure of the fluid is high. I don't know if it's clear. These are the type of question I like hearing. I'm probably able to say, what is this? What you can open by yourself and do what? See, or even inform us. I want to stop you. I want to. You see how the question came. There's something she not understand in it. She has gone through it, but there's something she not understand. These are things you can ask for an explanation, not what you can use your phone and do what? Open. What is this thing used for? Okay, Papa, you see it now. Three of us. Then if you ask him what it's used for, then I mistakenly talk one nonsense. He doesn't know it. It's wrong. I may tell you something else than what because most people that ask that question, they have seen something about it, but they want to hear from you. That's the reality. I have been in your shoes, so we have done it in the past. I'm not communicating. So, and we notice that is rubbish. Calm down and learn. Ask constructive questions that will help you to improve. Not asking what you can easily do what? Check up. Am I communicating? So each time such question come, I know. And I know how to answer it. Because we disturb now. But all this small children mentality. What does it even think? But don't worry, I'll ask him question. Then asking stupid question. Instead of you to use your time to think and reason, or to help you to grow. So what is this? He doesn't know anything. How? You don't know anything and study and he's teaching you. So whatever you are, so what you have done, if you see it coming, you know how to do it. Take care of it. If you ask consulting question, we'll discuss. I will explain to you. But if you have a question, check it up and come back. Then we'll discuss. Three people, I've told about two people to check something. I'm serious. So you come back here, we'll do what? We'll discuss it. Are we together? All right, please, let's continue. Have you gone from one lesson center to the just you heard that there's one man there that is too much? You want to go and see what he knows. That's the reason. You know the system. You know, there's one man there, he's very good in physics. Let's go and do what he knows. Sir. You go there, test, ask one. Say, he's trying. That's the reason. And this is reality. Time you are used to do what to grab from the man and add in your own. You are there to find out what he knows and what he does not know. Okay, so let's continue. So I think I've mentioned corticosteroids for what they do in what as inflammatory, right? I have been mentioning it since last class. I mentioned many of them. I've mentioned hydrocortisone, right? Even today I mentioned what betamethasone. Three of us use in eye watch. So from today henceforth, if you get an eye drop, please try to look at the content. That's another area people don't really take serious. Look at the content. Look at what they contain. Am I communicating? Very important. They're not the same thing. Give me a eye drop. No. All the eye drop, most of the drugs you see, you take as some of the drugs you take as tablet. You also see them as what? Eye drop. You can also see diclofenac eye drop is there as what? Eye drop. Even what is it called? Even ciprofloxacin is there as what? Eye drop. Dexamethasone is there as what? Eye drop too. It's also a corticosteroid. There are many of them. You see them as some of them as what? Eye drop for the eyes. So the eye is entirely a different world on its own. Am I communicating? Am I communicating? It's small. If you look at it, small, but a lot of things. That's small, but it's an organ. A lot of hope you know the eye is an organ, right? So it has tissues, it has cells, a lot of things are going on there. As small as it is, as if by looking at it, although you hope you know that is bigger than what you are seeing outward. I hope you know. Yes. Good. So what is conjunctiva? Has someone checked up conjunctiva? What is actually the conjunctiva? Oh yeah, tell us. I want you to find out and ask yourself. So where is the conjunctiva located? Where is the cornea located? Go to the structure of the eye and tell me where it's located. This is biology. So where is the what? Is what? No, say it, Dada. Conjure what? Oh yeah. Oh yeah now. Conjunctiva. What of cornea? Cornea is what? So then what's the difference between cornea and conjunctiva now? Cornea, okay, go cornea versus conjunctiva. See, let's see what is there. Cornea versus conjunctiva. Just cornea vs conjunctiva. Let's see if we can see anything there. Listen. Verse, right? Yeah. So conjunctiva covers the white part of the eye. White part. While cornea covers the iris. The what? Iris. So where is the contact lens placed? Your contact lens on the beauty. Where is your contact lens? It covers the lens. Who was I knowing that more? It's really like that one. Continue. Okay, so you say that the cornea is where? Covers where? The lens. While the conjunctiva is where? The left part of the okay. So when that you see a patient with conjunctivitis, be it bacteria, be it allergic, be it what is it called? Be it viral. You see that why this thing will turn to what? Red. Because of what? Allergic. Because of the allergy, right? It will turn to what? You itch. It's itching, right? Yeah. It's itchy, right? You try to, all the time your hand will be. But if it is bacteria or viral, there's possibility of what moving transferring to what? Another what? Person. Am I communicating? But if it is allergic, nothing like that. Nothing like what? Not like what transferring to another person. Am I communicating? But if it is unless the allergy, there's a small touch of bacteria without your knowing. That's why sometimes it's not everybody that has that issue, that red eye that you stay close to and you get infected. True of us, such case it is allergic. But if it is viral, that one is very, very contagious. Just simple eye contact, simple close, just you can contract it. Am I communicating? Bacteria is also, but viral is highly contagious. That's why Apollo. If somebody comes here with Apollo, give us 1 week. You must see at least 1-2 people that get it here just by sitting in the same class. Please let me to another one, please. I want us to finish this in today, so we go to a new topic. We have stayed so long on route of drug administration. Remember, ocular preparations, eye route is used to administer what drugs for local what effect, mainly for local what effect. Your intention is for that eye, not for you to go and start. It's for the eye is the main intention. Either allergy or either to take care of allergy or to take care of what infection or to correct anomaly, maybe to reduce intraocular pressure as you see in what glaucoma, okay, and other things mainly. Okay, the next one is I think we are done. Oh. Is there anything anyone we left out? What? Okay, optic is where? Huh? I thought it's esophagus. So. Is it where? 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 Ada, you're doing like this. Okay, I thought you say it's here. So also, optic is where? Your ear, right? Okay, thank you. So, so optics are you optic routes are here. The drugs are what administered to treat what ear inflammation and what infection. Ear inflammation and what infection, and is applied at the ear. What's that? What's foreign? Happen to? Use a treat what ear inflammation and what infection. So here it is applied directly to the what affected ear. Okay. So we can have ear. You can have ear drops. Sorry, you can have ear solution drops, yes, or even suspension. So typically they apply to the external what outer ear what canal. This is where they apply the outer ear what canal. So as the ear drop, is the target is what outer ear what canal. Hope you know that the main ear we have inner ear is deep inside. Okay, you know this thing you see here is not just your ear. Am I communicating? Is the what the outer one? And you have the outer, middle, and what inner. Remember your biology, right? Good. Okay, so of course you should know that before applying ear drop, you should make sure that you should make sure that what that the ear is clean. Okay, you can clean with what moist cloth and dry it before applying. The major reason is for local effect, even though minimal, small amount can still do what enter systemic. Okay, but the major is what you know that the human body is interconnected. True of what in one way or the other. True of us. Yes, you can put something here. You see it in your what in your what. What you put here can find its way in your what esophagus. True of us. True of us. What you put here can find. Haven't you eaten before? You do like this. You see the rice you are eating coming out from your nose. There are sinuses. There are interconnection. Okay, so just be careful. God just put some things there that way. This place will open. This place will close. That's why if you are eating and talking, it's very wrong. If that thing deal with you, eating and talking is very wrong. But while you are eating, the everything concerning your trachea down is closed, right? Is closed. Okay. Now, while talking, it will open for air to do what? Pass through. Then you are eating and talking. You are confusing the innocent this thing. I think the innocent What is glottis? What is epiglottis? Oh yeah, check it up now. Oh yeah, take it up. What is glottis? What is epiglottis? Now, I don't know whether it's double T or so. No, just Google it. I think it's single T. Google it. Glottis, epiglottis. Oh yeah, is it? Is that right? Thank you. Oh yeah, Google it now. Glottis, epiglottis. Oh yeah, what is epiglottis? What is glottis? Let's start from epiglottis. Double. What is epiglottis? Fast. It's okay. It's okay. Excuse. One person, please, louder.
It's more lead.
Lead, right? Just like lead that can cover and open. Okay, continue.
Just above the
Larynx, right? Larynx. Good. God bless you. La. Okay.
that prevents the drink from entering the white house. That prevents the drink from entering the windpipe.
The windpipe. Is that all? Good. Epiglottis is what? Movable lead. Listen carefully. That prevent food from entering the what? Windpipe. What is windpipe? From larynx. Larynx. Okay, what is the difference between larynx and pharynx? I'm teaching anatomy. Hey. Yeah, but anatomy class. But I want to make a point. That's what I'm saying. Just do it, please. What is the difference between larynx and pharynx? Larynx leads to where from where. Pharynx, one of them mouth to the esophagus, one of them nose to the. There's link. One of them has a link to the esophagus. One has a link to the trachea. Which one has link to the trachea? This one to where? Are you sure? Trachea. Laryngeal. This one to where? Esophagus. Check now. Use that your phone well now. Which one is that? Pharynx, okay?
And the esophagus.
Okay.
The larynx is the upper part of the trachea that contains the vocal cord.
Again.
The pharynx acts as a passageway for air to enter the neck.
Which one is that? Which one? This one. This one, Uncle.
So the pharynx is the tube that connects the mouth to nasal passages with the trachea.
Good.
That is the windpipe.
Okay.
The esophagus.
Okay.
While the larynx is the upper part of the trachea, like the upper part of the trachea.
Okay.
That contains the vocal cord.
Okay.
The larynx is located right below the pharynx.
Okay. Now let me make the point I want to make. What is very wrong and dangerous to be eating, talking while eating. Now, as you know, between the food you are eating that's entering the esophagus and the air you are breathing, as you are eating, not that air will not that you cannot breathe, you cannot breathe air, but as you are eating, this epiglottis will try as much as possible to cover the what? What does it cover? Windpipe, right? So that the food particle will not find its way to the what? To the what? Windpipe. Then, if you are eating and talking, you are confusing the what? Epiglottis. You are confusing the what? Epiglottis. You don't know whether to close or to open. And while confusing the innocent epiglottis, you see the food particles you are eating entering your what? You start coughing. True of us. Maybe the peppering. Is painful, right? And there's some people, in fact, you'll be gasping for air. It's a very dangerous situation. So please, as you are eating, let's forget whatever we think we are talking, we are saying. That it can never run away. Finish what? Eating. So that the epiglottis will know what it's doing. Are we together? That's the point I'm trying to make here. So You see now there's this inter what connection. There is interconnection. So what you use as eardrop can find its way, but it's not that. It's not for systemic. It's for what? It's for what? Local what? There's a situation whereby food cannot enter through your mouth. They put nasogastric what tube, NG tube, through your nose, naso. You find its way to your what? Esophagus and to your what? Stomach. Does it make sense? We call it feeding tube. So it's because of this interconnection behind that made it what? Possible. That's why if you see human skull, you see openings, sinus opening. These openings are there for a purpose. So what enters here can find its way into the word blood. There must be a way, but what will appear may not be that significant, be minimal. Unlike if you are administering through what intravenous, that is entering straight, or what oral that will enter portal circulation to before systemic circulation. But there will be some appearance of systemic. The systemic effect will be small. The center will get the adverse, whether advert or therapeutic effect is effect. It will be what? Small. So now, what drugs? I think we have some drugs you can use. Even hydrocortisone can be applied, used as what? To relieve inflammation, as a what? Otic what preparation. Even ciprofloxacin for ear what? Infection. Benzocaine to numb the ear. In fact, some of the ophthalmic preparation you can still see preparation used for ear and what? Eye at the center. Have you seen it before? Can be used for the ear and what? Eye at the same time. But there are some you see only for eye. Only for, but some you see both combined. You can use as ear and Ada is doing like this. Yes, I understand. Ada is making sense now, right? Good. She's appreciating it now. Please, if you can, even if you can look around anyway, you don't go out like that again, unlike before. If you even if you travel for a weekend, look for a pharmacy around your place, make them friends. When you're not doing anything, just go there and stay. Just be looking at their chef. Helping them to be bringing paracetamol, you're learning something. Don't stay at home and be watching your what I don't know. Look for somewhere close to your house. Go there, make friends. People make friends. Ask yourself, why are you friends with this person? Some of you don't even nothing. Be intentional. Make them friends. There's something you want to learn from them, and at the same time, you also give by helping them. Not just don't be selfish to learn and go. Also give to them by do what? Helping them to dispense. Even if it is filling prescription, as you are doing that, you are helping them doing that. You are learning something too. Am I communicating? Before you do it, each time you travel or each time you have opportunity to go, leave the gate of this school, go. If you do it consistently, most of the things you are doing, you appreciate it. Some of you, what you are saying, you look like one. What is he saying? Because you have not been opportune. The only opportunity you have is when you go for your IT. It's not enough. Even before you went for your long vacation, I told you this. I don't know how many people did it. If you come back, it will even make you to be more serious to class. Sometimes as human being, you may wake up. This flesh is one useless thing. You don't feel like doing anything. But if you remember, maybe this man will say something that I'll add to what I've learned. You'll be eager to go. But there's something you want to find out. There's something you want to confirm. I'm not getting. But if you do anything, you just woke up from watching film or there's nothing to confirm, you are even tired, you stay there and time is going. So please make out time to do this to help you. I am wanting to again. I go malo. I told malo again. I follow fake. Onye mara asụ. Ị mara asụ. Igbo language is rich. It's rich. Sorry, some of you don't know how to speak Igbo. Sorry. I'm sorry. But do you know the word for that? Do you know what even get me angry? More. They don't know how to speak English. They don't know how to speak English. They have no language. On the most serious note, when you now switch to English language, you can't even say anything. They look at you. Be good at one, learn one, and be good at it. Okay? Hey, let's continue. All right, I think with this, we are done with the route of drug administration. Now, let me test what you've learned so far. Drugs that undergo extensive first-pass metabolism have higher bioavailability. True or false? Why? What's the reason for saying false? How? How does first pass affect the reduced bioavailability? That's my question. By what? You go far. That's what I want to hear. Remember, I said that anything that finds its way, no matter how you do it, you will find your way into the liver, or except the drug doesn't have such, is not affected by such. The liver will deal with you first. When it's done, the remaining will now enter systemic circulation. By that time, bioavailability will be what? The one that is biologically available for the action. That means of bioavailability, the one that is available compared with the one that entered. Of course, bioavailability is a relative term. You are comparing it with what entered. Now, it will be very, very small. And if the bioavailability is low, the effect will not be that much. True or false? So that's why the answer is what? False. Because extensive pass. They even put extensive, so not just first pass, extensively. It will reduce it. Bioavailability will be what? Very low, not high. So the answer is what? False. All right, the second question says, which of the following is not administered locally? A. Intranasal. B. Intraocular. C. Intraarticular. D. Intra-aortic.
Intra-articular.
Okay. Any other answer? This answer is not answering. How can you say intra-articular? What is intra-articular in the first place? Joint. Is that systemic effect? When you inject inside the synovial cavity for the fluid for athletics patient, is it for systemic or local effect?
And this is size intra-aortic. You say that ears have local effects.
Hey. Ocular is what?
The eye.
Can one here? Where is it there? So in intraocular is for what? Is it local or systemic? See. Hello, listen, hello, are we together? Listen. Please remember, I told you something. The body is interconnected. Take a look at it. Is there any part of the body you will not see blood vessels? Is it possible?
No.
That part will die now. True or false? So this will tell you that there is no part that doesn't have a mixture of this route. But the point is majorly, the target is we do that majorly for this and majorly for what? That. Am I communicating? Intranasal can find its way systemic, but it is majorly what? Local. So it's local. It's for, you know the reason why it is? It's for what? Local. I just told you what it is now. Calm down. I said it's local. Is it what I said now? Have I answered the question? It's local, right? Local. Anyone you call it. Now, next, the second one, intraocular. Eyes, right? Is it more of local or what? Systemic? Intra-articular. Is it more of local or systemic?
Local.
What do you say local? Wait. Let's hear from you. What do you say local?
Like, because like the injection meant for that disease, right? And the drug is just meant for the brain, something like that. Desired points for the brain to do the injection at spinal cord.
No, it's intraocular spinal cord. Which one is for spinal cord? It's for intraocular, right? maybe his cerebral cavity is here. No, it's possible. You know, we have anatomical variations, right? We have an anatomical variation. Maybe his own is somewhere in the brain, you know, or the spinal cord, you know. now let's reason. You know, we have said it. I know it could be author, but let's reason this thing. Let's reason together now. Intra-articular. What is it used for? For what? Treating inflammation in arthritis pain, right? And it's into the synovial cavity, right? Do you think is there for that local effect, that area, the local effect in that area, or do you think it's treated for you to go to the pain center and work on the pain and then come back again and the pain center will not say same message back to the... Do you understand my question now? Huh? Do you think it's injected into the what synovial fluid for it to take majorly to take care of the inflammation at that point, and the pain there, or do you think it's injected there for you to get to the pain center in the CNS? Then after the pain center will now receive it and send feedback back to that area. It's both. So if your target, can you take a pain relief mainly for you to maybe as a tablet to take care of pain you are feeling there?
Yes.
And that one, is it systemic or local? In arthritis, you have arthritis pain, right? You go and buy, they prescribe diclofenac or any other NSAID for you, as the case may be, as tablet The pain is here in this joint here. The patient find it difficult to walk. The pain is much, and they prescribe analgesic, NSAID, whatever, as tablet, and the patient takes it. That drug the patient took, is it for systemic effect or for local effect? Some are still saying local. It's local. Because it will go back, enter the system, right? Yes. Now, but if you not target that place and inject into that synovial fluid, I'm not saying that it may not have system, but what do you want to? What is your target? Is it for local? Huh? Is it more of local than systemic? Is it more of local? Yes. D is intra-aortic. What is intra? Even though we didn't mention it, what is it? Intra-aortic. Okay, sorry, intra-aortic, sorry, yeah, right, intra-aortic, yeah. So it's local, more of local, right? Yes. This one more of what? Ocular more of what? Local. Intranasal more of what? Local. Intra-articular more of what? Local. So what's the answer? Okay. See what you do for me now, eh? Okay, let's ask if intra-articular is for systemic or wait. I want the one that's more of. I said that it can be for both. No, let's ask. We are discussing here now. We have discussed our own here now. Let's ask. So what are you going to say? Is there any answer in that question? Is there any answer here? Here, answer. Yeah, will answer. All of them have local intention. True of us. All of them have low, even though they have systemic a bit. All of them have a bit of systemic, but their intention are mainly for what? Local. This question have no answer. If I were you, I will leave it open and go my way. You must not see none of the above there. Be careful why I answer my question. I want you to reason, learn how to reason. It's not just I don't want to train people that don't, because real life scenario is all about your what? Are we together? Real life scenario is all about your what? How you train your ability to do what? Reason. Because you and the patient are there one-on-one. Let's assume you may be in a place where you don't even know pharmacist is there, no doctor is. Even though yes, you can still refer the patient to, but sometimes there are some things you can take care of. So if you don't have the power of, if you can't think out, if you say sometimes the doctor, I think have I told this? There's one experience I had when I was working in the hospital. When I was working in the hospital, I can't remember. It's been long anyway. But I was just on my own. It was a pharmacy technician that came and brought the folder. The lady refused to be a robot. You know what a robot is? The doctor has prescribed. The pharmacist has told us to dispense or has looked at it. You carry it, kabom. You give, you turn, you go and sit there. You're a robot. In fact, if we have money, we will buy a robot and discard you. Two of us. But the lady looked at the prescription, look at the folder, because in that hospital you can the folder comes to the what from pharmacy, not what is it called, prescription alone. So she looked at it and was like, the patient has what? Diarrhea. I Am I communicating? And the doctor now prescribe a drug that the patient also has this ulcer and hyperacidity and the rest of them. So the antacid that has some issues with what making diarrhea was also what prescribed, and the patient has diarrhea on her own good. At the same time, is an ulcer patient. At the same time, the patient is because she saw the diagnosis, saw the what the doctor before looking at the word prescription. She came to me and said, "Sir, I'm not comfortable with this antacid the patient this doctor prescribed. This thing can make the patient to even stool more. What do we do?" You see reasoning. She not one, she noticed it, and she not say, "So far, since I know it, let me now do what? Do what I think is right." She came to me because I was only pharmacist there. I'm surrounded by pharmacy technician. What I do is that once early morning, if I come, I bring her for like 30 minutes and teach them one or two things. I'll bring a topic, everyone for 30 minutes or before work start. I go very early. Teach them one or two things in pharmacology and pharmacy generally, topic to topic. She came to me. That's how do I put it? Not just that this person is a pharmacist. That mindset that he's my trainee is already there. And that mindset, let me find out what this prescription is saying. Since I have access to the folder, let me just look at it and see what is there. She came to me and says, look at, what do we do? I say, wow. I commended her, I say, wow, that's great. There are other antacids that can be used, but I will not go. Go and see. You know, he said, me, go and see. She came afraid. She said she's not going. I said, no. Was that the person that saw it? She said, no. And now you go and explain to the doctor what you. She dragged her food to after some. She said, okay, let me go. She must start calling. I encourage her, go. No, he will not eat you. He will just go. Immediately she went to the doctor, said, sir, look at. See, it's not easy. If you go to some hospital, they won't even have enough doctors. One person is short of 50, 100 patients, and they will line up. Sometimes your brain will be talking. Your mouth will be, your eye will see another thing, but your brain is interpreting another thing. It's where when the stress, when you have seen large number of people in there, it's not easy. You mean you don't say saw it. A second good thing that doctor is a humble type. You mean you saw it, she shouted, "Hey, me, prescribe this." No. They cannot go together. No, hey, please. He changed it immediately. When she came back, you see the joy, you see the confidence, you see the happiness, you see the joy written all over her face. I was able to do what? Do this. I was able to do what? Do this. If she the careless type, will she be able to do that? No. She'll be thinking, nah, oh, I can't get that. Nah, if a person never, nah. Without dedication, she wouldn't have done that. And the patient will also, because you don't know for a patient to have diarrhea and come to the hospital, to the extent of, most people, what they don't go and take flagell and be okay, two of us. But for this to be, it's something serious. You don't know the amount of electrolyte the patient have lost, and you don't know whether doctor's plan is to just do this. After this, let's know whether we'll place this person on drip and be able to do it to avoid loss of what more electrolyte and what dehydration. You don't know the situation of the because you don't see the patients. Your duty is not to do what you don't crack patient. It's not a duty, but doing counseling and you can ask one or two questions. Yes. So the summary is that she went to work and she was able to intervene in something. and she was proud and happy, fulfilled. That's called fulfillment. Everything is not about money. If you are doing something and it's giving you results, you are fulfilled. Those who are making millions of naira, they're not happier than you. You will not understand it. You can have billions in your account, but they're not happy. For it. I know you will say, money is not everything. You say it's not true. We need money, but money is not everything. Fulfillment. So, do you know why I'm going to this place? I'm coming down here because let me tell you, come in. Let me tell you something. If you have the mindset that money is everything, please, after this lecture, leave this department. Just listen. Hello. If you have the mindset, listen carefully. If you have the mindset that money is everything, you are not meant to be here. It's a fact. Oblapa, Ijelebe, Chube Gafo. Hello. If you have the mindset, I'm telling you now, if you have mindset, you are entitled to your mindset, what you believe in. But if you have the mindset that money is everything, this course is not for you. In fact, any health related course is not for you, because you place money over the health of a patient. You are not supposed to be here taking care of patients. You are not supposed to be there. It's not your duty. It's not for you, because you will not be happy. You will not be happy. You will not. If your source of happiness is money, you will not be happy. When you are, in fact, when you even graduate yourself, you may even put your certificate by the side and go and do other things. You cannot practice it. But it requires patience. It's not money. Yes, as you are growing, as you are doing your thing, listen carefully. Do you even know the main truth? If your focus is on money and you establish, people will lose confidence in you. They will lose confidence in what? In you. They lose confidence in you. Patients coming to your pharmacy or wherever they are coming to, they are watching you. They will lose confidence in you unless you will establish it and go and select people that money is not their target. You don't practice it. Are you practicing? You are not practicing. You can open a pharmacy, but you're not practicing. You can be a pharmacist and have money, go and source money from somewhere and open a pharmacy, but you are not there working. Are you practicing in pharmacy? You're not now. You're just a businessman. I'm talking about those that want to practice it. That's the point I'm making. I'm not saying those that want to establish and employ people and they're working, because you know that you cannot do it because your target is money. You can't do it. When you get people and they're working for you, you go and be doing your business. All you know is how much comes in, and you that establish that. See the twist of the whole story. You that say that money is your target, not the money. If you want to put people there, you will never put somebody whose intention is money. You won't try it. You look at those that will take care of your patients, so that money will come. But if you notice that somebody is after money, you start the person immediately. Two of us, that's a fact. It still boils down to the point I'm making. If you establish a pharmacy and you are not practicing, you are not seeing patients, you are not practicing, you are only doing business, which a non-pharmacist can still do. A non-pharmacist can see invest. You only invested in the business. You are not practicing. You are not practicing. A medical doctor that open a hospital and employ doctors, he's not sitting down there working, seeing patients. He's not practicing anything. Maybe he's in politics. He's not practicing. And he had told himself the truth. My target is money. Any investor, target are getting money. But if you want to combine it, you must strike a balance. You must give your patient what they need. You see that it's not money. Money will not be driving you. What will drive you is care of your patient. And is that care of your patient that bring that money? Because you don't even need adverts. If you take care of this person, he will go and tell the whole community that this doctor is something else. This pharmacist is something else. Please go to him. Even if the drug you have is twice the cost of what other people have, they prefer coming to your own. Because how you what take care of them. That's what I'm making. It's not about money. So if your target is money, please, after this place, after this, don't even try to practice. Keep your license and disappear. Go and make money. Get where you go. If you now raise a lot of money, you can establish and employ those that want to take care of patients and be paying them. Then you sit at home and do that and making your money because your target is what? Money. That's what I'm making.
Okay.
Are we together?
Yes, sir.
Good. Now, what even led to this thing, sir? Okay, I was trying to correct one impression, and I believe she has learned something from it. Now let's go. It's better. It's parenteral. It's intrathecal, not parenteral. It's injection now. It's injected now. I say injection route. Huh? It's not what? Wait, if you remove it, does it have systemic effect at all? But it's more of what? Local. If you remove it, you can put, if you remove it under local, it may not be able to see where to fit in more. You know, we have other injection routes. That's why it was aligned there. Does it make sense? Mother, come Martina, please take this like this, okay? Whether it was put, that thing should not be an issue for you. There are some, if you consult many texts, it's not the way I classify that you classify it. Are we together? Yes. So what if you see all those things? What you become even more confused. There are some textbooks you will see. You will not see this thing I said about local route, systemic route, systemic route. You have it. You not. You just parenteral and what? Enteral. Simple. So in that case, what are you going to do? Just know that this thing is just to do a classification that will help you to be able to do what? Understand where they belong to. But the major thing is that almost all of them have a bit of this and a bit of that. But it's more of this and more of what? That. Are there not drugs you take even through oral routes that have local effects? Are you aware? In the stomach. There are some medicine you take. There are some you take for local effect in the what? Stomach. Are you aware? Not systemic. The antacid you take, what is it for? The antacid you take, the tablet or the suspension, is it for systemic effect?
No.
Is it for systemic effect or local effect? You to neutralize the what? So tell me now. No, you must talk. So tell me now. What are you going to tell about it? So the basic thing is for you to understand the points. Okay, you cannot say that every oral route must be systemic, even though yes, it can be that it can enter the systemic circulation because it will definitely lead the stomach, two of us. But their target for taking antacid is to neutralize the what? Acid in the what? Stomach. It's local effect. It's not systemic. Even though it may have systemic effect, but that your target, your intention is not what? Systemic. Your intention is to neutralize the what? Does it make sense to you now?
Yes, sir.
Okay, now. Okay, let's look at this. Which of the following is not administered via the enteral routes? There's no okay. B appear twice. Okay, correct it, please. B, no, A is what? So which one are we even talking about? Okay, number 3. A is what? Sublingual. Is this sublingual?
No.
B is oral. Is it oral?
No.
C is rectal. Is it rectal? No. D is what, topical? Is it topical?
Yes.
The answer is what, topical. Number 4 is just a repetition of number 3. That's an error, please. Let's ignore that. Number 5 says, which is true of the oral route? Needs a highly sterile environment. Correct?
No.
Is it true?
No.
B. Absorption is affected by GI motility. True or false?
True.
C. Suitable for unconscious patients. No. D. Less convenient route of administration. Less convenient route of administration. False, right?
Yes.
So the answer is what? Absorption is affected by what? All right. Number 6 says, which of these is false about the sublingual route? A. It is a systemic route of drug administration. True or false? Is this systemic?
Yes.
The target is for what? Is the target for local or systemic? Let's look at the other option. B. Only small doses can be accommodated.
Yes.
C. Higher bioavailability than oral routes.
Yes.
D. There is no irritation of the mucous membrane.
No.
So what's the answer?
There is no irritation of the mucous
There is no what?
irritation of the mucous membrane.
Yes. There is irritation. True or false?
Yes.
Number 7 say dosage forms for IV administration include the following except A. Inhalers. B. A. Inhalers. Is it true?
Yes.
Is it the answer? A. Tiene mabaya ime ha hana baya leze. A. Tiene mabaya ime ha. Aya. Is it A?
Yes.
Okay, let's continue. The question says dosage form for IV administration include the following except A. Inhalers. B. Ampoules. Is it a dosage form for IV administration?
Yes.
C. Perfusion.
Yes.
D. Vials.
Yes.
So the answer is what?
Yes.
Good. Next one says drugs administered via IV route can be recalled by inducing emesis. True or false?
False.
Which one can be recalled? Which is true about IV routes? Which is true? Which of the following is true about IV routes? A. Not suitable for drugs that affect the gastric mucosa. B. Sterile condition is required to administer for administration. Sorry. C. Possibility of drug-food interaction. D. Painless. So the answer is what? Number 10. Next one says nitroglycerin can be administered sublingually. Good. Number 11 says inhalation of a drug implies A. Listen carefully. Inhalation of a drug implies A. Dissolving the drug under the tongue.
No.
B. Drug delivery directly to a vein.
No.
C. A way to deliver drugs to the lungs.
Yes.
D. None of the above. So what's the answer? Okay, the delivery of a drug. Now, superb. This your laughter. We need to go. We go for Oscar nomination. Delivery of a drug through the skin is known as. Wow. That means you are ready for this exam now, right? Transdermal. Okay. The routes of enteral administration of drugs are good. Rectal, oral, sublingual, all of the above. Thank you. Next one. Advantages of the oral route of drug administration does not include. Advantages of the oral route of drug administration does not include A. Easily self-administered. Two of us. Is it the answer? Eh?
Yes.
Hey. So oral route of drug administration does not include easy self-administration. But I say does not. It seems now. Ọgbara adịghị n'ime ha. Bụ ndị che na ama the answer. Mana ha amaghị ya. B says toxicity and overdose. Toxicity and overdose may be overcome with antidotes. C. Drugs go directly to the systemic circulation. D. It is relatively safe. So what's the answer?
C.
Huh?
C.
Huh?
C.
Okay, C. C says what? Drugs go directly to the system. So in oral administration, drug does not go directly to what? It enters portal circulation first. It enters the liver. What happens to the liver and liver is what portal what? Circulation. It enters portal circulation first before systemic circulation. It is in the portal circulation that is on some drugs undergoes what? Which metabolism is that? First pass what? Metabolism. First pass metabolism or first pass effect. First pass metabolism or first pass what? Effect. Okay, with this, ladies and gentlemen, we have successfully come to the end. Yeah, you said we're not done with what? I see your 4. Anybody have? Everybody one. Afu ọgbọmịa. I can see it too. Search. Why is that in my material? Umuazia. Okay, let's look at it. Number what? When the medicine, listen carefully. When the medicine is administered into the spinal cavity, the route is known as what? Even Gedeko sa gugu nyandesa. Munu jidekunuji. And number 16 says, in an unconscious patient, which is the preferred route of drug administration? Oral is not, enteral route is topical. Huh? Check it off. So all this while you've been with this thing, you need to check up what intercourse is. Hey, wow. If I were you, I would check whether it even exists. Intercourse. Osteo means what? Each time you see osteo, what does it mean? Osteo, talk about, right? Osteo. Each time you hear osteo, what comes to your mind? Bone. Osteo. What comes to your mind? Bone. I'm not saying that's what it is, so I'm just asking you a question. What do I know? So, what is intraosseous? She's not even the driver person itself. Look at human being. I said, oh, do it now. Why? Yes, she's an entrepreneur. Yes, she's an entrepreneur. She knows you need data to study. So she provides data. So she's a good entrepreneur. She's a good entrepreneur. Yes. And she's helping you to meet your needs of data. So she's providing a solution. Alright, let's continue. Martina will tell us the meaning of intraosseous. Find it out now.
Is the placement
Where? Number 17 says, are we together?
yes.
Which of these are factors considered in choosing? Listen carefully, please. Hello, one house. Are you guys? Should I go? We have 11 minutes to go. Please, let's conclude this. Before I go. Which of these are factors considered in choosing route of drug administration? A. Rapidity of desired response. Is it a factor? Chemical characteristics of the drug. Is it? Condition of the patient. Is it? So the answer is what? Number 18 says, listen carefully. Intra-articular route of drug administration. In intra-articular route of drug administration, the drug is delivered to A. Arteries. True or false? Okay. B. A. Tell them about the hello. With this thing you are doing, if you come for other interview, I am one of the you have issues. So because I laughed, you just change your answer immediately. Okay. All right. A. Arteries, right? Arteries is what? Intra what? Intra what? Arteria. Good. B is atria. Is it atria? C is joints. D is areolar tissue. So the answer is what? Joints. Number 19 says, which of these is not a dosage form for topical route of administration? Which of these is not a dosage form for topical route of administration? A. Solutions. A. Solutions. B. Aerosols. C. Gels. D. Ointment. What's the answer? What's the answer? Aerosol is for what? Inhalation, right? See his face. One body are not confused. She's confused. All right, next one. Number 20, Hello? Listen. Someone say something now. Let's go back to that question. Let's go back to that question. Someone made a very important point now. Listen. Let's go back to that question again. It says, which of these is not a dosage form for topical route of administration? A. Solutions. It's not for topical, right? Are there solutions you can apply on the body? Example. Yeah, there are lotion. Someone said that I like confusion. Are there lotion that are suspension? Are there lotion that are solution? Are there lotion that are solution? Huh? You will go far. This way will go far. 7 keys. Dr. Aladdin, 7 keys. Blah, 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 blah. Is it a solution? If you put it, do you see any pattern inside it? Aladdin, not Kamal lotion. The one Dr. Aladdin 7 keys. She has normal popular 7 keys before. Is it a solution? Yes, it's a mission, we know. But is it a mission? Is it solution?
Yes.
If you open it, do you see any particle suspended in it?
No.
It's clear, right?
Yes.
Can you drink it?
Yes.
Can you apply it on the skin?
Yes.
So, solution can also be applied to topical, right?
Yes.
We are combining dispensing. Hope you now appreciate the beauty of dispensing, and you're now applying everything together to understand what you're doing. Can you apply it on the skin? I know. Even in the direction, you can apply it on the skin at the same time. Yeah, 7 keys. I'm sure of that one. Confirm. You can do that. Okay, now what of aerosols? Can you spray it? You can spray it, right?
Yes.
What of gels? What of gels, right? You can apply it, right? Ointment, you can apply it, right? So do you think this quiz will have an answer?
No.
You will go far. But aerosol, why we just jump to is that our mind went only when you do what? But you can. Sorry, I did not formulate this question. I did not formulate it. I just got questions from different sources. I did not formulate it. Are we together? Even the answers are not that. The answer, I just formulated it. Want to give it to you. We are answering the question as the hot here now. Are we together? There are no pre-recorded answer anywhere. I'm asking it with you now. I'm keeping it rare. Everything now is rare. Like this, I just got questions from different sources. So everything is rare. So we are answering it together. Don't think you know the answer. I at the back of my head. We are listening. I'm not communicating. Yeah. So don't see that it's a question. That's why it's not an exam question. Any question I'll give you as exam question, I would have answered it myself, formulating it myself. Even if I got it from somewhere, I'll answer it. Be sure that options are what? Correct. But this one is just what I added in your handout to help you study. So we are answering together. So I don't have the answers. Am I communicating? Yes, so any answer we are giving now, we are giving. That's why I want us to reason. That was someone gave an answer. Someone pointed out. I said, let's go back to it again and reason it out. You said no without reasoning. But she mentioned something. She said, sir, out of those one you do what? Are they not aerosol? Remember when we did aerosol in dispensing? What do we do about it? That's what led us back to it. And having gone back, we saw that it truly there's no answer in no answer here. Am I communicating? Next one says, which of the following is not, or which is not, is not an advantage of topical routes? This is the type of student I want you to be. If you understand everything I've been doing from your first year, this is the type of student I want you to be. People that reason, not people that just anything you give them, they cram it and be going. Am I communicating? A student that says, sir, this thing you are saying, this thing you said, I'm not so. So what do you think? Let's revisit this. You can say it without being rude. Hope you know. So please, can we revisit this? Can we revisit this? There's something I'm not so convinced about, or I'm not that. Please, can we do that? Then we do that. Lo and behold, we may go back there and we realize that you are actually right.
Yeah. Yes.
This is the type of class I like attending, because not those that will stay after milking you, there's nothing you are getting from them. Don't 2 hours I'm with you here. You make my life for 2 hours. Immoral. You don't know. And I will go empty-handed. I feel cheated. Yeah, I feel cheated. I feel that we should also do what? Interact. There's something you know. The world has changed.
Yes.
The world is in your palm now.
Yes.
The whole world is here. Are you aware?
Yeah.
It's in your palm. So knowledge is no longer restricted to your professors. It's only professor that is arrogant that will not understand that knowledge is no longer restricted to who you think you are. It's now here. So that's why whatever I come here, I want you to bring it on. Let's share it. So next question says, which of these is not an advantage of what topical route? A, it gives high local concentration. Does topical route gives high local concentration? Yes, that points locally. That points. You're listening now, right?
Yes.
You go far. At that point where you applied it, there's high concentration there, so it gives high local concentration. Is it an advantage?
Yes.
Is it an advantage?
Yes.
The question says, which of this is not? So is it the answer?
No.
Because it's what? So, but B says easy to use.
Yes.
Is it easy to use?
Yes.
Topical is easy to use,
yes.
But is it the answer?
No.
Good. C, local allergic reactions.
Yes.
Does it have local allergic reactions?
Yes.
Yes. Is it the answer?
Yes.
Is it the answer?
Yes.
It said not an advantage. Is it the answer? Otu nwa amadi etiela ọgbaghara dị n'etiti ndị chere ha ma ya mara ha ma ya. What's the answer now? The answer is what? C or D? If you say D, let me see your hands up. Okay, no one say D. So allergic reaction, is it an advantage or is advantage? All right. Not 21 says listen carefully. Bisacodine suppositories represent what type of drug delivery? Bisacodine suppository represents what type of drug delivery? Let's take it step by step. A says parenteral and local. B says enteral and local. C says parenteral and systemic. D says enteral and systemic. So the answer is what? Enteral and what? Local. Okay, let's go again. Hello, if you have objection, my lord, don't worry. I will not overrule it. I'll give you a fair hearing, okay? I will never overrule it unless it is proven beyond every reasonable doubt that your objection is what overruling. But let's go back to the options again. Okay, the fight now is between B and what? D. Okay, let's go to B. B says enteral and local, right? And C says enteral and what? Systemic. Okay, so if you are for B, let me see your hands up. If you are for B, enteral and local, let me see your hands up. Now everybody say Dinko. Only one person. Okay, all are not sure. I ask. Right. Of course, that's why the question. That's why you have these options. No. Anusol. What does anusol contain? Anusol is for pile now. Pile and hemorrhoids. That's what you wrote. So how can you say that I said it? No. You can hear something like that's true or false. It's a possibility too. It's local now. Answer is for what? So how is it systemic? Let's finish with her first. Auntie, calm down. Let's finish her. We have to with her. Miss, wait. Miss Bisakode. Check whether it's systemic or the why. Let's continue with that one. Okay, what do you see? Read the document.
The other active ingredients in anisole is C plus suppositories exert their therapeutic effect.
Wait, no. Continue, please.
Therapeutic effect without being absorbed.
Now look at you. You run out of. No, you must give a mistake with the answer. Go back. Then go back now. Browse it. Monkey or browse it. See. Buy data. Someone else can do that, please. You want to check if Bisacori has systemic or local effects. Let them confirm it first now. I enjoy it when you confirm it because it will sink well and you will never ever forget it. Like
In the form of suppository has a local effect on the bowel.
on the bowel, right? Good. God bless you. Locally acting. That's what I want to hear. Locally acting. You see this thing we are doing here? Even if you are 50 years old, you can never forget this again. Lie, it's not possible. It's not possible. And anyway they bring up the topic route of drug, and you can stand for 10 minutes without holding anything and discuss it. I'm confident that you can do that. Unless or except if you've not been following us. Now, so it's what? Internal and what? Local. Next one says, which of the following medicines does not mic went up since I didn't even know. Only God knows how many hours ago. So people watching us have been hearing without hearing a sound. I just pray that the hey, oh, wow, this beautiful argument, this beautiful issue now, we've lost it. But it's okay, let's continue. Let's continue. Okay. So we say which of the drug administration is not a parenteral route? Afterwards. Okay. Hey. Okay now. It's type error. God bless you. Which of the following route of drug of administration is least likely to give a systemic effect? I think someone asked me this was some time ago.
Yes.
The answer is what? Oral. Okay, let's place them in from the highest to the lowest. Highest one is what? Followed by what? Followed by what? Then topical, right? Go. Number 23 says, which route of drug administration is not a parenteral route? A rectal. B intramuscular. Parenteral. C intravenous is parenteral. D subcutaneous is what? So the answer is what? Rectal. Parenteral route of drug administration is the same as DAS route. Hypo what? Okay. That's why, because that's what is the official name of the syringe you use for injection. What's the option name? Is hypodemic what? Syringe. True or false? Is hypodemic what? Syringe. Is not. Is hypodemic syringe. Is not. Is this hypodemic? Okay. Okay. Google hypodemic.
Okay, is the bottom layout?
Check if they are check these two terms. These two. Once you check out, once you take needle, let's see what is there. Hmm? What's that? What do you see there?
The category of medical tools which enter the case is a very thin product tool with one shaft.
That the needle you see now. Is that like hypodermic syringe?
Yeah.
What's there?
A small strike.
The same thing, right? The point is that it is hypodemic. Am I communicating? So the answer is what? Everything there, all those nonsense there is that all those options are there to confuse you. That's their mission. Hypodermal. The answer is what? Hypodermal. See, number 25 says, in intravenous route of drug administration, bioavailability of the drug is dash. The last but not the least, why are sublingual tablets better for relieving angina attacks than traditional tablets? A, they are smaller. Is it because they are smaller? No. B, they bypass the stomach, entering the bloodstream for quicker relief. Yes. They are cheaper. Is that the reason? No. So the answer is what? B. D is even there to confuse you the more. They are cheaper and they are smaller. The answer is what? B. They bypass the stomach, entering the bloodstream for quicker. B. Because apart from being destroyed in the stomach, entering the stomach will not give a quick what? A quick onset of action. I think we are done with routes of. Hello? We are done with routes of drug administration. In our next class, we can start from factors modifying the dose and effect of what? Drugs. The factors that modify, that will now say this is those that you should use, this is those that you should not use on this social patient. We look at the factors that determines that. Are we together? Yes. Unless you have any question, if not, we have even exceeded our time, sir. We are 16 minutes past the 9:30. So I think we'll stop here for today. With the way you were destroying the questions, I'm confident that we did something in routes of drug what? Administration. And I'm confident that if you go out of this place and if you are asked, have you done route of drug administration, you can confidently say yes. And if you are asked, please, can you give us a 5 minutes lecture, 10 minutes lecture, even 20 minutes lecture on drug administration, you can do that. That's the mission. And I think the mission is accomplished. Thank you very much for your attention.
Thank you, sir.
See you next time. And God bless you.